Welcome to Healthcare Today. I have discussed a lot of things about flat foot, like how the flat foots, how to recognize a flat foot, who affects with flat foot, like those things. Today I will talk about why we should not ignore flat foot. We know that everybody with flat foot doesn't have much problem. Few have severe problem and few they do not have any problem in the beginning of their life, and they usually ignore their flat foot conditions. Sometimes the problem they faces are far away in the body, actually they are related to flat foot, but they could not recognize it. So let's watch my video carefully so that you will understand why we should not ignore our flat foot. Before that, let's see how our foot works. So this is our foot model, and we have arch in the foot, and the foot works like a tripod, just like a camera tripod. You have seen already there are 3 pod in the camera. Like that, in our foot also there are 3 pod. One is our heel and another 2 is big toe and small toe. When we stand, here is one pod, here is one pod, and here is another pod. This 3 pod like this. So our ankle is on the center of this pod. What happens in flat foot? When the foot gets flats, then all the foot drifts outwards and the ankle, it drifts inward and it deviates from the center of the tripod. Our foot bears the weight of our whole body when we stand, we walk, we run, we climb stairs, at every activity. So if the foot shape changes, not in a proper shape, that means in a flat, then the whole body weight, they also shifted and drifted from the center of the foot. The center of the foot is the top of the tripod, that is our ankle joint. So what happens when this shape changes happens? So when the flat foot happens, the center of the tripod, that is the ankle joint, it drifts inwards. The forefoot, this area means this area, they shifts outwards. At the great toe, the more pressure comes, and due to that, the floating tip of the toe, it bends this way and it forms hallux valgus, a bunion deformity. This is a painful condition, and due to shape changes, all the small joints here, all the small joints and the bones, they are forming the foot shape and carrying the whole body weight. They also get drifted and gets unwanted or awkward stress and pressure, and due to this awkward stress and pressure, all these joints and bones in the small joints and bones in the foot, they start getting degeneration and arthritis happening. So when you are young, you have flat foot, you may not have problem, but if you ignore and continue with the same thing for lifelong, at some point of your life, you can get pain of foot, different areas, hallux valgus or bunion, and painful things. So these are the things can happen in your foot, but when you have a flat foot, it does not affect your foot only, it affects your whole body. Normal tendency of our human body is we want to keep our shoulder and face straight and balance. When the flat foot happens, the foot drifts outwards, ankle drifts inwards, and with this drifting, the whole shin bone and knee, they twisted inwards, and both the knee, they forms a knock knee, valgus deformity, and due to inward shifting of the knee, it also creates a movement in the above hip joint also, it also move inwards. When both the knee joint turns inwards, hip turns also inwards, they pushes the whole pelvic area, that our hip joint area, to tilt forward. When the hip tilts forward like this, if from side, the spine, the curve increases. What happens ultimately? Flat foot is called also overpronation, ankle drifted inside, it twists the knee inwards, also twists the hip inwards, that forces the pelvis to tilt forward and forces the spine to create extra curve. All these phenomenon creating extra load or awkward pressure to your knee, to your hip joint, your thigh muscles, and also the spine, and you may develop knee pain, thigh pain, back pain, and you may not find anything abnormal there, only because of flat foot you are having this problem. So, you should not ignore your flat foot. If you have flat foot, already I have discussed and told you how you can recognize your flat foot. Please consult a specialist orthopedic or foot and ankle surgeon so that you can treat your conditions. We care about you.